words of euthanasia activist Jack Kevorkian. Do any of you here think that helping someone suffering is a crime? Any of you think this? Say so right now.
Me.
Well then, what are we doing here? Patient decides when it's best to go, not the physician. Jack said these words at the University of Florida in 2008 during a lecture explaining how physician-assisted suicide is a reasonable and ethical way of ending someone's life. After reading multiple chapters from these books, I will explain to you today why the act of giving someone terminally ill a lethal injection, or euthanasia, should be legalized in the state of Pennsylvania. There are many reasons why it should be legalized, but the three main ones are that patients should not have to suffer the pain, the process is painless and easy, and it eliminates the chance of them committing an unsuccessful or extremely painful suicide. To start off, euthanasia is an unknown topic to many. The dictionary definition of it is the practice of killing a human being or animal for humane reasons, especially one suffering greatly or experiencing poor quality of life. Currently, it is legal in several countries and the states of Montana, Washington, and Oregon. And the status quo of Pennsylvania is that it is illegal and considered as murder. But according to my aunt, who is a nurse practitioner, hospitals are currently finding ways around the illegal euthanasia law. For example, they have one man who was on his deathbed having an incredibly hard time breathing, so they simply gave him a large dosage of morphine to stop his heart. But one of the main reasons why I'm doing this topic is that 1 year ago my great uncle intentionally overdosed on pain medication because he was denied euthanasia treatment, and that was very difficult for our family. But before I get to the evidence, I'd also like to briefly show you a website I found that from the people who are against euthanasia. Now, here their mission statement reads, "We are committed to the fundamental belief that the intentional killing of another person is wrong, and we have deep sympathy for those who are suffering." Do you know what they're saying? If they're suffering so much, if they have so much sympathy, then why don't they just help the suffering end their lives by legalizing euthanasia? But anyway, there are three main reasons why it should be legalized. And the first is that terminally ill shouldn't have to endure the pain, only being able to look forward to their end. Currently, passive euthanasia is legal, while active is illegal, and the main difference between the two is how close the person is to dying. But this means that someone who is living continuously with horrible pain and no chance of recovering cannot be lethally injected, and they are left to continue an awful life. Also, a terminally ill patient can be as young as a teenager, meaning that they must continue for months of their lives in a hospital bed because they are denied the easy way out. People who are not suffering intense pain are usually on strong medications and drugs. Although this eliminates the pain, it takes away their normal personality and our feelings as they experience odd side effects from medicines they're given. In a survey in 1992, only 51% of the people of terminally ill patients knew who they were or where they were the day before their death. And I found that information from that source right there. My next main argument is that the process is painless, easy, and predictable. Giving time for knowing exactly when you will die and being able to complete all the things necessary before your death is very important to a patient in the hospital. In a Netherlands survey in 1992, 97% of people receiving euthanasia has said they completed what they wanted before their death. Meanwhile, only 80% who weren't receiving the treatment said they completed what they wanted before their death, including writing their will, saying their goodbyes, and resolving conflicts. And I found that information from the source. The other main point is that the process is very easy and admirable by many. Each year, hundreds of terminally ill people flock to the states of Montana, Oregon, and Washington to end their miserable lives. For example, in Oregon, over 400 people have used the Death with Dignity Act since it was passed in 1994. This means that over 400 people have voluntarily and willingly gone to Oregon to end their miserable lives. And I found that information from a Wikipedia article on Oregon death treatment. A final reason why euthanasia should be legalized is that it eliminates the pain. It eliminates the chance of a painful or unsuccessful suicide. Each day, there are over 1,500 unsuccessful suicide attempts in the world. And 25% of these are by people over the age of 65 or terminally ill patients. Some ways of killing themselves include starvation, intentional overdosing, and removing the machines that are keeping them alive. Now, each of these is very painful and will be unnecessary if euthanasia was legalized. And I found that information from my next main point is that the majority of the terminally ill have the desire to die, and that can't be ignored. This can easily be seen with the death with dignity, or with the do not resuscitate form, which is a form stating that if the terminally ill patient goes into a life-threatening event, such as a cardiac arrest, then the paramedics will not attempt to resuscitate them or bring them back to life. And here's a copy and pass around. But to solve the problem of euthanasia, I've made a plan that allows terminally ill patients to responsibly use the treatment. The requirements of this plan are that they must have an incurable and deadly disease, they must have signatures from 5 family members or friends approving that they received this treatment, and they also must have at least 2 signatures from physicians approving their condition as terminally ill and incurable. But what I would like you to do is to simply mail a letter to this address, which is in capital Harrisburg, and requesting that they look over the idea of legalizing it in Pennsylvania. And the address is right there. You can write it down if you want. But in conclusion, euthanasia should be legalized for the terminally ill in the state of Pennsylvania because patients should not have to suffer the pain. The process is painless, easy, and predictable, and eliminates the risk of a patient committing an unsafe or extremely painful suicide. To end with the words of Milan Kundera, dogs do not have many advantages over humans, but one of them is extremely important, and that is that euthanasia is not forbidden by law in their case. Animals have the right to a merciful death.
Thanks, Trevor. So, what was that?
Drew, I'm taking this home.
What?
I'm taking you just back.
I might need it. Alex, don't be mean.
What? Drew, I'm not going to be mean. I'm just going to be like,
Who's Milan Kundera?
All right. Thanks, Trevor.
He's a famous doctor.
Never heard of him.
She's on the wall. Never famous doctor.
Oh, she's a
Alright guys, let's get this in. We only have a few minutes left. Go ahead. Guys, gentlemen, ladies, Dr. Jane. Alright, go ahead.
That's really blurred.
Something that, like, some people who are terminally ill can be, like, sometimes too broad because they can live from, like, 6 months to over